Hello, everybody. This is Dr. Langdon, board certified pediatrician, chair of pediatrics, and director of University Health Center. So today's topic is for all of the third year medical students who are just starting on their clinical rotations. This is very exciting. And some of this advice also would apply to our recent graduates who are starting internship right now. This is a very stressful time because you're going to a new level of responsibility and there will be so many people asking you to do things, and it's an entirely different circumstance. So I've been working a lot. At our school, we do a sim month, the month before the now rising third years go off to clinical rotations and try to review a lot of things, including what it's like to round in the hospital and present to your attending outside of the patient rooms or even with the patient present. Just going through a lot of different sims in our simulation lab. And it's been fun, and I'm so excited for them. And the way our school works, the students go out to different clinical campuses around our state so that they can have experience working in rural areas. And that has been shown to improve the chances that they'll choose some healthcare shortage areas eventually. Now, they're representing us out there on those clinical campuses, and certainly our interns at residency programs all over the place are also representing our school. So know that we are rooting for you, we are proud of you, and we know that you will represent us well. Now, what I was telling the third year students I was meeting with today are a few quick tips about dealing with this giant transition. First of all, know that everyone in your position feels a twinge of imposter syndrome because you've always had to be a good studier and a good test taker and a good memorizer. And these are different skills than what you're going to need now on rotations, inpatient and outpatient. We've been practicing, but this is the real thing. When it really matters if you have some empathy for these patients, it really matters if they feel that you're truly listening to them and caring about them. Don't forget that we've taught you to ask them about the emotional impact of their chief complaint. Don't forget all the things you've been studying so hard all this time. So a couple of tips. If you are in a situation on rounds in the emergency department and outpatient clinic, and the attending asks you, or if you're working under house staff, intern or resident, and they ask you if you want to do a procedure, know that the answer is always yes. And I normally tell people, trust your gut, go with your instinct. Not in this case. Your gut is going to say, are you a lunatic? I just finished second year. I don't have any experience. I can't practice doing an arterial blood gas or whatever it is I might need to practice. Yes, you can, and you're never going to get good at it if you don't start. There always has to be a first one. So here's your clue for knowing if it's your turn to take your first attempt when that procedure is offered to you. If you decline it, you may not get any more offers. The whole world these days is filled with learners, and so there's a lot of competition for that space to get your practice in. This is the time to do it. Don't just give it away and let somebody else do it. Second, you do not need to kiss up to your attending, but you do need to at least be kind. If you are presenting a patient when you're in or outpatient to the attending, remember that we do need the important details, but we don't need the massive details because everybody's on a schedule. We've got a lot of patients to see. We do love it if you know what the topic's going to be on rounds that morning and you read about this topic the night before so that you can discuss it intelligently with the attending. Like I said, represent us well out there. Dazzle your preceptors. We want to keep all of our preceptors and hopefully recruit even more. So work on your patient presentations. Next, don't feel like you're supposed to already know everything. Everybody else who's a physician now had to start at this third year level practicing and learning on rounds and in the office and everything. So it is okay to ask other people. Remember that we've taught you about interprofessional education. Here's your big chance. If you don't know about something, ask. Call the lab. Make friends with your nurses and the front office people and everybody, the admin folks, the nurses, the lab folks, the pharmacists. All these people are there to work together with you as a team to provide the very best care for the patients. So communicate with them. This is not the time to have some sort of an ego battle with somebody else. Get over yourself. The more humble you are, the more you can learn and apply it to take better care of the patients. That's what's most important. You can keep a journal. This is a very, very inside tip here. Believe it or not, you starting third year folks, in only 1 year, you're going to be thinking about applying to residency. And if I'm your faculty advisor, if you choose to do peds or med peds or child neuro, I am going to need a personal statement from you. So here's this red hot tip. If you're on clinical rotations and have an amazing, life-changing experience with a patient, an epiphany, if you will, that suddenly you say, oh, I felt so useful and alive and important and valued in this relationship with this patient and what I did for them or this procedure or whatever happened. Write it down now when it happens, because a year from now when you need to start writing your personal statements, maybe you wouldn't remember that. And so if you could just write down, I was working with this child who came in with this diagnosis and suddenly he looked at me and realized I was his advocate, or whatever it is. Write it down now and you can use it later, which would be super helpful. Here's my final tip. I've got so many more, but here's just one more. And that is, each time you're on a different clinical rotation, I want for you to just sort of play an internal mental game with yourself and say, this is what I'm going to be. So for example, when you're on psychiatry, I want you to just think about, I could grow up to be a psychiatrist. When you're on surgery, same thing. When you're on OB-GYN, when you're on peds, when you're on family medicine, when you're on internal medicine, whatever it is on those mandatory core clinical rotations, third year, just imagine yourself being that. And it works very well because your mind's more open to learn more information, and you need all this information on a third year medical student level. You'll need some of that no matter what you end up pursuing. And also, I'm not saying that all attendings are full of pride or ego, because we're really not, but it does just touch our heart if we think you're truly interested in what we chose to do as a profession. Because think about it, we're all humans. And if I feel like you really care about children and child health, and that maybe could make us have a bias towards you on whatever rotation you're on. So if we feel like you're going to pursue the career we're actively practicing, it kind of makes us happy. But most importantly, it's because you'll learn more if you perceive yourself doing that as a career while you're on that individual rotation. I hope these were practical tips I meant for them to be. If you have additional questions, let me know. If you yourself are already a healthcare provider and have tips for our third year medical students going out into the big world, or for our interns, feel free to comment below. Thanks so much.